It's Soulbirth time here on Edge Radio Australia. That means lovely Faye is here. And look, she's got the headphones on, got the cans. She's very industry feeling. Very official. That's right, yeah. You've got, this is your radio equivalent of, you've got your wings. Right?
Oh, yeah. You go.
Absolutely lovely to see you. Always great vibe when you're in the studio. Yeah, it's very true. You bring, I don't know, you bring this wonderful calmness to the place.
I do.
Yeah.
Very zen.
Very zen. I bring the manic, you bring the zen.
There you go, reach the balance.
Yeah, that's it. A bit of yin and yang works very well. Now, we have a special guest today, don't we?
We sure do.
Hiding out there in the green room. But before we bring her on board, do you want to give a little intro?
Yes, well, definitely, because today we're talking about a really nice, interesting subject, back to pregnancy and birth. And
something I know so much about.
And everything in between, because this topic relates to everybody, of course, but, you know, specifically looking today as well at pregnancy and birth. But we're looking at chiropractic and somatic care.
Ooh.
And we have an amazing guest on with us today, all the way from the US, coming to join us, Elizabeth Wisniewski. And she has got a lot of initials or letters after her name.
Oh, very
well qualified here. Thank you. So just a little short intro is Elizabeth is actually a Webster and Perinatal Certified. She's Embodied leadership coach, somatic educator, and president of Dream Planet Incorporated, with a PhD in somatic depth psychology and more than 2 decades of experience in integrative care. She supports individuals and organisations in leading from a place of embodied clarity and purpose.
Yep.
As a visually impaired leader, Elizabeth brings a unique and deeply attuned perspective to her work.
Okay. Yeah. It is great to have different perspective there.
Yep. Her approach is grounded in 5 core pillars. So embodiment, empowerment, empathy, energy, and education. She also practices as a certified perinatal chiropractor in Ventura, California.
Right.
And offers virtual coaching worldwide. So with all of that, amazing. I can't wait to have this conversation today. So welcome, Elizabeth.
Let's bring the doctor in the house. Hey, why not indeed? How are you there, Elizabeth? Lovely to have you here.
Thank you so much for having me.
Oh, absolutely.
It's a pleasure. Yeah. Thank you so much for joining us, because like you're over there in California.
Yes.
Is it 8 p.m. over there, I understand? Yesterday, 8 p.m. yesterday. We're in Perth.
Oh, yeah, we're so ahead of things.
Yeah, this is time travel at best. We're in tomorrow for you.
So true. Well, I'll tell you right now, I mean, this is the thing. Let's be very, very simple here. Okay, birth is about everybody, every nation on earth, let's face it. So different perspective is a great thing. And obviously, culture-wise, things are going to be different for wherever you come in the world. So, yeah, this would be great to hear. I'm interested in the chiropractic thing. That's a bit I'm waiting for. I'm going to get there, because I think that's a really fascinating part of medicine, quite frankly.
Yes.
But I'll wait my turn. It's okay. I can do it.
Well, we hope so.
Give it a go.
Yes, I'd love to hear from Elizabeth and like a bit of your journey as to how you came to doing what you're doing, because you have like done so much study across so many areas, and I love the fact that you integrate them all together, and a lot of it is very somatic based. So, you know, working with all the trauma, releasing trauma from the body throughout different stages of life. So, yes, can you share your journey with the audience? I'd love to hear about it.
Well, thank you first for that introduction. I'm so excited to be with all of your listeners and with both of you today. And my journey it's interesting, because I thought I was going to go to law school, and I double majored in environmental studies and political science.
Right.
And did all this environmental justice work in Latin America. And that really felt like my trajectory. But about a week after I finished my undergrad, I went back to my home state of Michigan in the Midwest of the United States and had my 30th eye surgery. And instead of gaining more vision back, I lost the remainder of my vision.
Oh, I'm sorry.
Oh, it's okay. And so, but that's what got me here today. So I have this rare eye disease. That's a retinal disease where it detaches. That's mostly found in boys in the Middle East, and I'm Polish and not a male. So nobody else has it in my family. So I really feel like it was a soul contract, but that's after decades and so much work and therapy and everything to get to that embodied place. So that's what got me into this. And I went to massage school, and a couple weeks in, I went to my dad, and he paid for my undergrad, and I thanked him for doing that. And then said, I think I'm going to go in a different direction. I really believe I'm meant to be a chiropractor. And I had never taken any anatomy or physiology before, but it made sense to me, and I could do it without having to see. So then I went and I took all my prereqs for because I had a BA and I needed all these science classes, and I took classes like chemistry and physics without being able to see them,
Wow, that
building
would
different
be
models. Yeah.
extra challenging. My gosh, I can't
That's
even imagine doing that.
so impressive. But like what I was saying before, and sort of, I probably didn't articulate this very well. Looks many times in the world, things like this, challenges like this, is actually a gift. This sets you off into another direction and gives you, for one of a terrible word here, but focus. Like, honestly, so no, good on you for finding your life purpose.
Yeah, thank you.
And so often too, when we lose capacity in one area, like one of our, with vision,
Sure.
then it attunes you higher to the other factors, doesn't it? Like the sense of feel or the intuition and the and sensing everything around you. So you've probably got a much deeper sense of what's going on for somebody, because you have to feel into it and listen to your intuition as well.
Mm.
I agree. And we've been able to prove that through functional MRI studies, where they can see that cells will migrate from one cortex of the brain to another when there's a lost or diminished sense. And so I certainly feel that in my own body in terms of hearing and even palpation when I'm working on a patient, being able to feel a slight bit of inflammation or a misalignment, or to be able to work on a newborn baby very gently. That takes, really keen palpation skills. And so I know that in my soul and Soma that that's one of my gifts.
Yeah, absolutely.
Oh, look, I can totally read into that, because I see a chiropractor, and she is absolutely wonderful, and I've seen many over my time. And this is the first time in my life I've seen a chiro who has that incredible sense of I don't know, a next level of touch. She can go, oh, there's some inflammation there. I'm like, really? Like, how can you possibly tell? Because it seems to be so deep. So no, that is a great sort of insight there, I guess.
Yeah, I love that. And I think that comes down to any sort of healing. Is what I started to notice when I was getting my second doctorate in somatic depth psychology, was that chiropractors or any sort of healers, body workers, they might work with the body, but it doesn't mean they work with the soma. And the soma is your subjective first person lived experience of the body. And for me, that kind of has a little bit of soul connection, like a soul spark within that. So an example to know the difference between the body and the soma would be when you pass away, your body is still here on earth, but your soma isn't, because that's your lived experience. And so a lot of people can touch the body, but it doesn't mean they're tapping into that deeper lived experience for that person and what's going on in all 70 trillion of their cells.
I totally agree, because that's how I work a lot too. With my work, I tune into the soul and communicate with them on a different level and pick up a lot of other things that you don't pick up on the physical realm. So, yeah, that's why I feel so aligned with what you're doing there, and it adds so much depth to, what you would ordinarily expect to get from like chiropractic care.
Yeah, absolutely. And it ties so deeply with your work with being a midwife, and we're all on that journey together to help people.
I know, and I love the fact that, when we were having a conversation about how you work with pregnant women and newborn babies and at birth. So can you kind of share, the work that you do with pregnant women, and what kind of things are you releasing from their, embodied state to prepare them for birth?
Yeah, absolutely. Do you want me to talk a little bit about that?
Yes, we'd love to.
Okay. Well, one of the things that I see the most in my practice would be breech presentation. And it could be, from anything where a foot lean, frank breech, or the legs are right out in front, or even transverse. But I don't turn babies, because that's the practice of obstetrics and out of my scope. What I do is balance the pelvis and work on the sacred sacrum and get everything aligned in the pelvis, because the baby has agency and autonomy. So when you can balance the pelvis and make sure everything's moving properly, if the baby's able to turn, they're probably going to. The times I see that not happen is when there's a short cord or something we're not sure of. But 2 weeks ago, I had 5 babies turn head down, after 1 or 2 adjustments. And it's so amazing, because you're giving this person a different experience potentially for birth. And I saw an OB friend of mine, she came in to get adjusted, and she's like, you're single-handedly changing the primary C-section right here. And I'm like,
wow,
well,
that's
don't
huge.
call the hospital.
You're killing their profit right there.
Great. And that shows the importance of the work that you're doing. How amazing.
Yeah. And, and I'm just facilitating that or advocating for it. I don't, as a chiropractor, I'm not healing your body. Your body can heal itself, but I'm helping that process happen. Same with balancing the pelvis of the baby. If it's right, like I said, their agency and they're autonomous, they can do that.
Yeah, absolutely. It makes such a difference to the whole birth process as well, even with the head down. If the woman's pelvis is out of alignment and the uterus is a bit skew-if, then it's going to, affect the labour process, giving birth.
Okay.
If everything's not in alignment. So the work that you're doing is like so valuable.
Thank you.
I've got a question then on the issue of, what is it called? Endo. I can never say that. Yeah, I can't say the full word. Okay, trip over the tongue on that one. But the alignment in childbirth, well, actually, sorry, no, but well before childbirth, with becoming pregnant and alignment with that sort of thing. Can chiropractic help in that regard?
We don't claim to cure anything, but certainly miracles and so many amazing things can happen when your nervous system, because that's what we're working with, is the nervous system. We're not back pain doctors. But when the nervous system is optimally functioning, you never know what's possible. There's so much potential there. So I certainly have seen that happen in my practice. I've had pregnant people be able to carry full term with healthy, successful, unmedicated births, with fibroids and cysts and all sorts of things that are going on that may seem like on the outset they won't be able to carry to full term or have that unmedicated birth. But when you can align the pelvis and just get the nervous system optimized, anything is possible. So I really try to be very clear in the philosophy that we're not curing anything.
No, that's right. And I love that too, because I think the majority of people don't realize too that, our body actually knows how to heal itself. And, if it's given the optimum conditions to do so,
it'll do so.
Because, when we abuse our body or, do all kinds of things over our lifetime.
Why'd you look at me when you said that?
I don't know. It's just but when we do these practices that actually help align the body and bring it back into balance, then the body can get on with what it needs to do and what it knows what to do. Is that correct?
Absolutely. And, another example from my practice would be, and I know in Australia there's a lot going on within pediatric chiropractic with laws and everything there, but here in the U.S., it's a bit different. And so we see, I'm able to see lots of newborn babies, and they're sent in by pediatricians and doulas and all sorts of providers. And what can, if they have like a nuchal cord where the cord is wrapped around their neck, that can be really traumatic. So when I work on a baby, I'm just using my fingertip, kind of like I'm touching my own eyelid or testing a tomato if it's ripe or not. Such little pressure. And that's why it's important to have those palpation skills. But I'll witness babies where they sigh and they quiver and they let go of that trauma. And that's so powerful. And just talking to them from a trauma-informed perspective of, oh, that was probably really scary when that cord was wrapped around. And then, just talking them through that so they may be able to recreate the crawl to the breast to initiate breastfeeding or whatever it may be, is really helpful for them. So that's a good trauma-informed perspective in terms of chiropractic as well. And they don't have a placebo.
Sorry?
There's no placebo effect when you're working on a baby. They're not
that's
like,
right.
oh, I don't know if this is going to work.
No, that's right. They don't let their brain.
No, that's a good point. Well, I was going to actually make the point of, obviously, okay, you can tell me if I'm right or wrong. I can't imagine the child understands English, or what you're saying, but I think that the tone would be very, very important, and the energy would be important. Would I be right there?
Yeah. Yes,
and I think sorry, Elizabeth. I was just saying it's a soul thing as well, because you're communicating not necessarily with their physical self, but with their soul self, or because they understand you on that level energetically. You don't have
that's kind of where I was going on. It's an energy transfer, right?
Yeah, totally.
Yeah, absolutely. And then
sorry.
Oh, no, go ahead.
That you also attend births, don't you? So you're able to do this work right when the baby is born, and also to help through, any blocks that the mother might be having during the birth process. But to be able to do this correction immediately after birth is amazing.
Mm-hmm. Absolutely. I have a lot of midwives and OBs where they'll see patients in early labor or sometimes active labor and see babies at a day old. And when you're talking to them, it's not tabula rasa where they're a blank slate. There's so much there already. They've done in utero studies where a baby, half these people are going in for amniocentesis with putting the needle through to draw the fluid, and half are just going in for like an NST or just a normal exam. And they've been able to see that the babies will strike at the needle when it comes through to pull that fluid with the needle. And often they'll stop moving for at least 30 minutes. So
Wow.
there's a lot to be said about preconception trauma, but certainly in utero prenatal trauma as well. And that influences them a lot. And so talking to them really can help from a perinatal psychology standpoint to mitigate trauma, but also to do immediate trauma repair work. So if I have a patient going in for a cesarean birth, I'll be like, pick a point person, maybe it's your doula or somebody else or a nurse, to narrate that for the baby of, this is what's happening. We're going to go through these 7 layers of tissue, and this is how you're going to come earthside. And that can really help. The babies often will be in a greater state of ease.
Yeah, I agree. Yeah, it's all about communication. That's what I found so many times as well. If I'm attending a birth and I can tune into the baby and actually have that conversation, find out from their perspective as well what's going on for them during the birth, when they're in utero and finding their way, navigating their way through.
It's a very unique sort of skill. Let's be honest. It's not what everybody can do.
Yeah, but I believe, everybody has the capability to do it if they, practice and tune in and, heighten those senses like, we've obviously done through need or whatever. Sure. But, to be able to do that, I think it's good if mums can do it as well, because then they're in tune with their baby while they're giving birth or during the prenatal period. So all of these, offerings that we have that can help connect the parents with the baby is fantastic.
Yeah, and on that point, do you find that you'll do some manipulation from a chiro point of view with the mum during the birth?
I certainly have. Yeah, absolutely. I've had one person's water break on my chiropractic table. She was days into labor, and I had never met them before, and they were calling me referred by one of my friends, and it was a very, surreal experience. But the dad kept saying, her husband kept saying, she thinks the baby's stuck, and I was like telling her, check in with your baby, put your hands on your belly, and we're just working through these contractions, sitting on my table. And so I was using a lot more of just perinatal psychology skills and trauma-informed care than adjustments at that point. And so I told her husband, next contraction, I want you kind of like on the ground, put your hands in the belly, it's time. And he did that. And it was like a movie with a pop and a gush. And, I was calling the midwives, and it was wild. So, it's not the most common experience I have, but I certainly see people in early labor to the point can feel the muscles that are along the spine kind of ridging, and I could be like, ooh, I think this baby's OP or sunny side up, and kind of give a heads up, and then later on that is confirmed. And so it's interesting, the cues and the signs when you really pay attention to what's going on in the pelvis, what you can just feel.
Yeah. Wow, beautiful. So do you attend many births at all? Like, do you work as a doula, a chiropractic doula, or is it just when you're called in to particularly align someone's pelvis while they're in labor?
I've done doula trainings and postpartum doula trainings, and I want to do that, but then I have found that it really makes my schedule a little too challenging, having to reschedule 25 people and do all that. So I can't commit to that, but I'll see people in early labor or support them.
It's tough being so popular, right? I get
yeah.
I totally get that, because to be a doula, you need to be on call for the birth, and babies don't exactly fit into your schedule. They don't say, hang on a minute, when have you got a free appointment? They just come in there.
Some hospitals in WA they do, but
Yeah,
Exactly.
that's like what we talked about at the beginning with different cultures of birth. And there's certainly places like the US has a 31.9% cesarean birth rate right now. And it looks like it's
Just
not going to drop for 1 or 2 decades.
No, that's
no.
right.
I mean, I bring that up because my eldest son was born in this new hospital at the time, and long story short, I was having a conversation. He was born naturally, but the from the point of view of, I was talking to some staff later on, and they actually called the place Caesar's Palace. And they literally told me, and I can't remember exactly, I think it was something like 72% of births there were Caesars. And I just thought, you've got to be kidding me. Like, the most natural thing in the world. Excuse me.
Yeah, individual hospitals have different statistics, and some have higher cesarean rates than others. But, again, you can use your chiropractic care or tuning in, energetically working with people to actually help the baby through that transition as well as the mum, because there's different sets of conditions that they face, depending on the type of birth they have.
Yeah. And I find, we don't want to be dogmatic about it either. I would often talk about having a birth vision instead of a birth plan, because for me, that vision has more expansiveness and freedom within it to, maybe go some different directions. Because sometimes cesarean birth is warranted. And, the WHO says 10 to 15% of the time it is necessary, because there's nothing showing a decrease in morbidity or mortality for the mom or baby after that 15%. So it is overutilized, but within that 15 or so percent can be life-saving. So even though I'm a chiropractor and we practice, we don't have prescribed drugs or perform surgery, I still recognize, and I want to say also my dissertation for my PhD was actually on C-section. So I went 401 pages of writing into that. So, I learned a couple things.
Yeah. What were your key findings in that?
There was 4 key findings, and the first was birth plan and choice. And that's, I had a plan and C-section was not part of it. And most of the people I interviewed had said, I didn't pay attention to that part of the birth class. And I just didn't think it would be me, even though it's a third of the population here in the US. And so it's interesting. So what I tell my practice members, when you're doing childbirth education, pay attention to all of it. And if we get to a point you might need a C-section, I'm here for you before and after. I'm going to teach you how to massage your scar, or, whatever it is. So that was the first. The second was something I called the liminal space, because I was interviewing people who had unplanned C-sections. And that was the space in which they were whisked away. They're going through this threshold, not only into motherhood, but also into the operating theater, often separated from their doula, their birth worker, their partner. They're giving these medications that are making them shake and convulse, not being told that that's pretty normal for those medications. So it's really scary. And so that was that space in between the portal of motherhood and, being cut open is, deeply metaphoric. When we look at, because I'm in the step psychology stuff, so I'm looking at mythology and, how we can look at that. And then the next one was really deep into obstetric racism and violence. And I really focused on that because here in the US, Black women die at 3 to 4 times the rate as white women. And so I went deep into that. Or people I interviewed were like, I don't think the doctor would have treated me that way if I didn't have curly hair. They were literally, that's the stuff they were saying.
Wow.
And so
no way. Seriously?
And what we found in the research is that the most educated person of color, woman of color, is treated this, just as poorly as like the lowest cost of white women. So people like Beyonce and Serena Williams, they were on the brink of death, where Serena Williams, is this world-class tennis player, was ignored. That she's like, there's something going on. I've had this.
Serious? I can't get over that.
Oh yeah. So
in this day and age.
I mean, it's and this in the throughout the world, and especially in the US, really has this deep tradition in the granny midwives in the South, where they were patrolled. Of you had to be wearing all white, and they could inspect your entire house, your personal house. And if something in your house is out of order, you would take your midwifery license away. So it's like
Oh, wow.
regulated and rooted in racism. So this continues into obstetrics because Marion Sims, who invented the speculum and some other devices, used still in OBGYN clinics today, practiced on his quote unquote enslaved women 20, 30 times a procedure to perfect it with no consent, no analgesics, nothing. These women didn't have a chance. So that's where it's rooted. Yeah, it's really disturbing. And so I speak out a lot about that too. So that was my third finding. And then my fourth one I called on the verge of vaginal delivery, because all the people I interviewed were at 9 to 10 centimeters dilation, and then they were in that mother blame game shame of your pelvis isn't the right size, it's too small, your baby's too big, and some of them had gone through several rounds of pushing and laboring down, and then were told, like, let's just do a C-section, it's easier for you.
Easier for you. Who? Easier for who?
Right.
Well, you've got to think about the doctor. He's got his heat off time. He doesn't want to miss that. He's got 18 holes to play. Unbelievable. I'm sorry, I don't want to focus on this too much, but I'm absolutely blown away by the racism thing, because, to me, it seems that obviously we live in Australia. We're a long way away from the US. But I've got American friends, and we talk about all sorts of things, and to me, there doesn't seem to be that entrenched racism. Like when I watch it on the news, mind you, I don't believe anything I see on the news. Mind you, that most of it's propaganda. But what I'm getting at is that the public perception, or what they try and push through, say, the more dishonest news, like the CNN, NBC, all that kind of thing. They tend to push racism. Whereas the Americans I speak to every single week don't seem to be living that experience, right? Black or white. So I'm very, very curious about that. Like, about what kind of research did you do that showed this up?
It's everywhere in the research. There's so much showing, like I said earlier, that Black women die 3 to 4 times the rate as white women during childbirth in the US. New York City, there's research showing that's at 12 times the rate. And so this is institutionalized racism. This is entrenched in the culture and in healthcare, and especially within obstetrics, because of the founder of gynecology, Marion Sims, practicing on enslaved women. So this is very well documented. And so we have to look at our own sense of privilege. And for me, I'm a white doctor, so it's my job to educate other doctors, especially white doctors, so that we can change this however we can, so that all people are treated with the respect they deserve. And it's uncomfortable, and that's okay. We need to be uncomfortable in it, because there's no reason anyone should be dying, especially 3 to 4 times the rate during childbirth in the US. That's bananas. So I've had this affect patients in my practice. And so it's really important to me to speak out against it.
Yeah, good on you. Well done. And so there is the organisation Human Rights in Childbirth. So, which they do a lot of research into all of this as well, don't they? And add a voice, advocacy for that in all areas, because there's so much increasing obstetric violence as well, which has become a big problem.
It just blows my mind. We live in, both of us are living in a first world country, all right, some 70 odd years after the whole, the racial changes theoretically in America. 70 years is a very long time. Civil, not civil war. It was very much an ethical war. Let's face it. All of the civil rights movement was such a big deal and such a thing that shaped America. I can't believe that all of these years later that would still be an issue.
Oh, absolutely. And with all these increasing, with the issues like magnifying, I feel, and it seems to be getting worse, not better.
Sure.
And also that in your work that you're doing, it creates more work for you because you're releasing trauma from the body, aren't you? So, and there is so much trauma embedded in women after these traumatic births, when they've experienced, obstetric violence, then when they go into the next birth, they're carrying all that previous trauma with them. So a key element of your work would be releasing that trauma, wouldn't it, to make way for a clear path this next time around?
Yeah, absolutely. And here's the ways that we can hopefully prevent some obstetric violence and obstetric racism are two things. Be in therapy when you're pregnant, because trauma comes up and that can be really scary. And so I've had people regress into babbling like they're a toddler, and then the psych wards call in, and that can, lead you down a really scary path. And so, doing your own work while you're pregnant can be so good, of drawing that out, dancing it out, maybe doing, somatic-based therapy. But also the research shows across the board, having a doula is the #1 way to prevent a cascade of intervention, and also prevent some of that neglect and violence and disrespect.
Yeah. Look, Elizabeth, I'm clearly a man, and I, I've never been on this side of things. I think that, and when my children were born, I like to be very involved. I did all cutting of the cords, all of that, and it was, obviously a very, very big event for me as well as my wife. I think that I never understood before the importance of a doula, and over the last couple of years, oh my word! Like, why would you even think about having a child without a doula present?
Exactly.
Yeah, a person there to support you and to be your advocate, to speak up for you and make sure that you're protected. And
absolutely. And as a husband, I gave it a red hot go as being the advocate, and I'm doing the massaging, I'm doing the holding the hands, I'm taking the abuse, I'm all the kind of carry on that goes through it. But let's be frank, men don't have children, right? So we can't give birth. Having a doula there, I think it's just a magnificent difference, and I really encourage people to look into it for themselves.
Absolutely, because they're going to also advocate for your birth of vision and making sure there's not tools and instruments used that you do not want used, and that you're being respected throughout the entire process to hopefully have a physiological birth and to follow that progression. So that's that cascade of intervention that can be prevented, which often leads to, if we're going down that line of intervention, coercion, and sometimes I've been at births where they're clearing the table, they're like, we're going to do an epidural, but really the person's ready to push. So it can kind of go in different directions, but having a doula is really kind of help.
Yeah, absolutely. I agree, because when a woman is in that stage, especially when she hits, around the transition period, when she's like, just get this baby out, it's really good to have somebody who knows that woman and supports her and says, can actually advocate for her and say, look, this is the hormones talking.
Yep.
This is what she wants. This is her vision. And, if somebody's coming in right at that moment and trying to, do the epidural or the forceps or anything or do a big cut, it's great. Like, really, really important to have somebody there that can
I would think that these people who are doing these things, who are getting the forceps and that they would understand their industry and understand women to such a degree that they would wait. They would understand the psychology of a woman when she's going through, all those endorphins, all of that adrenaline going through her body, and
you would think,
this is their reality. Expertise. No.
This is why continuity of care is paramount, whether with a non-wife or, having a doula there and then going to where you're going. If you arrive when you're ready to birth, then that's perfect timing. But to have somebody like and trust with you at your birth, that's why I've always said it's so important to choose your care team, who your providers are going to be.
That's why I was so nice to my mum. 4 minutes in the hospital when I was born. Thank you very much. I'm rather proud of that. I was caring about it.
You were so thoughtful, weren't you?
I am very thoughtful.
So, Elizabeth, when so you do a lot of work as well postnatally, so adjusting babies afterwards, and like I can swear by that as well, because like with my children, I also I discovered chiropractics when my first baby was young when he was only a month or two old because he had severe colic.
Right.
And then a friend's husband was a chiropractor, so he kind of adjusted my son, and then it was like after that he was fine. So that was my introduction to chiropractic care, and then I discovered that the chiropractor could adjust my pelvis and help me to get back into alignment and a whole lot of things, and also I dislocated my tailbone. So I was having chiropractic care to adjust that, and then it all corrected itself after the second birth because the chiropractor just happened to be at the birth centre I was birthing.
That was a bit handy.
He came and adjusted me right before the birth, and then he was there after and did an adjustment on myself and my baby straight after the birth. And I've sworn by chiropractors ever since because that is invaluable. So can you tell us a bit about, how you work with newborn babies and mothers in that immediate postnatal period?
Yeah, absolutely. So often I will have, if they're choosing to breastfeed, have them on the breast, and I'll have the mom kind of reclined. I use these wedges under the pelvis from one of our techniques. There's over 200 technique systems in chiropractic. But this technique is called sacral occipital, or SOT. So they're these wedges you put under the pelvis. So I'll do some cranial work on the mom, just keeping it really gentle because their hormones are shifting. They have so much relaxin. So keep it really gentle at first. And then I'll have the baby and I'll feel, where's the restriction, testing some of their reflexes, checking the spine, especially the top and the bottom. And so feeling that top bone, the atlas in particular, is that kind of stuck under the back of the skull, the occiput. And having them nurse while you gently adjust them, I find is so profound because the mom often will experience the latch shift. And so the pressure I mentioned earlier is like testing a tomato if it's ripe. But to put that into perspective, couple things, because I'm all about qualitative, like it feels very divine feminine to me, but here's some quantitative data. So the average forces of birth for a vaginal birth would be about 37.5 pounds of pressure. So a whiplash injury is about 30 to 50 in a car accident. So it's a lot. And when we're doing baby adjustments, it's 1.7 pounds of pressure. It's so gentle. So when parents first come in, if they're a family I haven't worked with before and they're bringing me like a 2-week-old baby, the first thing I say is I'm like, hi, I don't know what you've seen on TikTok, but I'm not going to manually adjust your crack or manipulate your baby's neck. And they're like, oh, thank God. So I just like to clear that.
People have about baby adjustments, and I'm always too to actually, support chiropractors
because it sounds a bit scary.
People think you're going to and go crack, and it's like, no, that does not happen. No, they had that at birth.
Now, an important part of every show that we do is me making a car reference, of course.
Oh, no. Here we go.
Or some sort of motor racing reference. And just to put it out there that the kind of PSI you're talking about, that's about what you should be running your tyres, just so you know. Oh, yeah. About 36 PSI.
Wow.
Perfect.
Wow.
But I'm joking about it. But at the same time, that's a lot of pressure.
It is.
Right?
But that's what I've always said when a baby's coming through the birth canal, they're twisting and turning each way.
Yeah, I never considered this.
Yeah, and so many birth practices when you don't, like I'm all for hands-off approach and letting the baby kind of, find its way out.
Sure.
But so many, like we were taught when I was trained, was to actually hold the head and you pull it down to get the the first shoulder out, and then you lift it up. So you're pulling the head, and to me, that's like, so can you imagine the adjustment that poor baby needs after that, having its neck pulled in both directions?
Not to mention if forceps or vacuum extractions used. And so here's some more numbers, is that when you're getting your blood pressure taken, it feels really tight around your arm, around 200 millimeters of mercury. Vacuum extraction can be upwards of 400 to 600 millimeters of mercury on that baby's head.
Way.
I mean, I had a patient recently where they were like, we're going to give this vacuum 3 times, 3 shots. And this was after she really pushed back. She didn't have a doula, first baby. And she told me she regrets that. But she was like, I don't want a C-section. Can we try anything? And I said, we'll give it 3 times. So she's asking, should I be pushing? Should I be pushing? Nobody's talking to her. So that 3rd time she feels the vacuum, she pushes. I mean, she tore pretty badly, but she was like mama bear, like, I have to get this baby out. I don't want a cesarean section. So having a doula could have been helpful. But that poor baby, like we're working with an IDCLC for lactation. She's getting chiropractic care, both her mom and baby. And so we're working through it, but there's a lot of trauma repair now that needs to happen, from physical to emotional to spiritual.
Yep. Yep. Oh my gosh, so traumatic. And these are the things that we need to help the woman to heal before, to go into motherhood, because that really impacts you as a mother, to then breastfeed and raise your child, and it impacts on your self-empowerment and, how you are as a mother and how you carry forward. It's the, not only the physical trauma, but also the emotional and spiritual.
I can imagine
mental,
that.
Everything.
And my thought on this is that very much so, okay, don't get me wrong, I know that births are theoretically, a lot safer than they used to be. But, okay, we have been having babies for probably billions of years. I mean, well, I don't know, millions, a damn long time. And I'm quite sure for most of that, we haven't had vacuum cleaners, right? Just, it's such an unnatural
vacuum
thing.
Cleaners.
Yeah, we are. I'm a guy, come on.
Vacuum for the house, quite different than that.
That's it. I'm out there with the vac software going. But it's such an unnatural thing, right?
Yeah, but the
absolutely.
technology has been beneficial because it helps babies that would have otherwise died in the past.
That I agree with.
Mothers.
I see that.
However, when they're overused, when the mum is perfectly capable of pushing the baby out, and it's done, as a, to hurry things along, it's not always warranted, and you can do it a lot more gently than it is done. I think there's a lot of education needed around, how to do things more gently and how to help the baby and lessen the trauma on both mother and baby, which is a lot of the work you're doing, Elizabeth.
Yeah. On the chiropractic sense, chiropractics now are far more gentle than they were sort of 40 years ago, right?
Depends on the practitioner, I would say.
Yes, definitely.
There's over 200 techniques. So, and a lot of chiropractors will, over time, often come up with their own ways of doing things as well, because your body's changing. I've been in practice as a chiro for 13 years, and my fingers are crooked in some areas, and I get a manicure, I'm like, oh, that finger doesn't go that way anymore. So I'm learning different ways of doing it. So, but with my population, I love manual adjustments, but I also know that's not right for everybody. So, going back, a lot of stuff we've been talking around would be consent, I would say. So something I tell to every new person in my practice is, for me, consent is ongoing. Consent can end at any time for any reason or no reason at all. So, having that sense of safety is so important, because if somebody doesn't want their neck adjusted, even if I'm like, well, that would really help this person, that's my ego. And so I have to check myself and then be trauma informed and, offer them different options. Maybe we just stretch it today, I want to build trust.
Yeah, exactly. And can I just clarify too for people listening, because in your introduction too, we talk about your Webster Perinatal Certified. So what's the difference between that and normal chiropractics as well?
Sure. Webster is a weekend course. It's our prenatal technique. And really, it's not even a technique. It's an analysis of the sacrum, that flat bone, the base of your spine. And so we are analyzing that to see what's stuck, what can we release, and we often use the drop table that goes up and down, that can be pretty loud, and release some ligaments and round ligaments, the hip flexors, and that allows that balancing so the baby can turn. And then the perinatal certification is newer. This is all through the International Chiropractic Pediatric Association, and you can go on ICPA's website and search for perinatal and pediatric chiropractors anywhere in the world that have done the extra training. But perinatal was another 11 courses. Each one had an exam. So I did that during the pandemic while writing my dissertation and practicing. I went hardcore into it as soon as it was released.
Just like you needed a few extra things to fill your time.
Yeah, exactly. Like, who needs to sleep? So it's a bigger certification.
Well, that's really impressive. With the drop table, though, which I'm a big fan of. I've only recently, these have only come into my life in the last sort of year. Do they ever have those in birthing suites? Because, geez, that'd be handy. No,
not in the birthing rooms.
No.
Unless portable one that you do.
Yeah, unless you bring your portable. My portable table does have a lumbo pelvic drop piece actually.
Oh, wow.
Which is nice. And then I use pregnancy pillows, and it's really safe for the baby that way. Yeah, but the drop table's great. It's based on physics. It's one body stops while the other stays in motion. So it's also called Thompson drop table. So that here, at least in the US, is one of our main techniques we're taught in chiropractic school.
That's amazing. And so have you got any hints on for pregnant women that are approaching birth, different things that they can do somatically or whatever to help align their bodies or to attune themselves with this process that's going on to help release trauma that might be there, or to help align their pelvis, different things that they can do?
Yeah, if you've had a previous birthing experience that was not ideal for you, I would say write it out, voice memo yourself, draw it out, paint it out, dance it out, get it out of your body. And that's a way to make meaning of it. Because for millennia, women would share birth stories, and that's how they could find wholeness. If this is your first baby, your first pregnancy, then absolutely get some sort of birth worker like a doula to be there with you. That's going to help. Have this birth vision. Be more expansive than just a birth plan. Really think into those details and different scenarios. And then I encourage them, try different things. Find a perinatal chiropractor or an acupuncturist. I also refer all my people, prenatal and postpartum, to pelvic floor physical therapists, no matter the mode of delivery. Really important. There's a lot of birth prep that can be done, or like a spinning baby's aware practitioner. So I really I often find that the baby is the teacher, and a lot of my type A business moms are like, I'm going to work until my water breaks. I'm like, okay, well, what if your water doesn't break?
Because people always just think there's a natural progression that your water always breaks. Like, well, no, my babies, they would have never broken until their head was coming out, or even after.
Stubborn nuggets. Jeez.
That's a good sign.
And so get that self-care, because that's often what the baby wants you to slow down. And slowness is this revolutionary act of cultural resistance, and that can be uncomfortable, but that's okay right now. And talking to your baby, singing, reading to them.
Absolutely. Couldn't agree more.
Absolutely.
Yeah. So on the same page there. I think number one priority with all of this is connecting with your baby, because it's like a co-creation here. It's you and the baby. It's a family event, and keeping the communications going and working with your baby, because you're a team. You're both in this, and so communicate with them and be aware of what's going on. The baby, like you say, the baby is our greatest teacher. They let us know if we're not meant to be doing something.
I absolutely agree. We're going to have to wrap this up.
I know.
Now,
I could talk for hours.
I know.
I love these.
Look, you could talk underwater.
You can't talk. You can talk. You can talk better underwater.
Quite honestly, yes. Excuse me. I keep losing my voice. Do you have any sort of conclusions that you sort of...
Well, I'd love to wrap up with Elizabeth. Thank you so much for coming on. I would love to continue this more. We've run out of time, unfortunately. But women that might want to contact you, or couples that might want to contact you, because I believe you work virtually as well. You can have consultations via Zoom anywhere in the world. So how can people contact you?
The best way to get a hold of me would be through my Instagram at Dr. Elizabeth Wisniewski, and you'll see my link tree there, where you can find all my different items, like Dream Planet that you mentioned at the beginning is a tech company I'm president of, all the way to my embodied leadership coaching and just general embodied coaching. My website's about to change, so that's why Instagram is really the best way to stay up to date with me, and you'll see everything from embodiment coaching to me working on babies.
Beautiful, and I've got your link tree link. We'll drop it in the...
It's already there. There we go. We are on it. There's the description there. That's always a great way to catch up. Thank you so much, Elizabeth. Really appreciate your time and all your great knowledge today. It's been an absolute pleasure.
Yeah, thank you so much. It's been amazing to have you on, and hopefully we can continue the conversation another time as well.
That'd be fantastic. Thanks for being part of the show. Of course it is. What is the name of the show again?
Soulbirth.
That's right. It's here on Edge Radio Australia.